Good morning to our online webinar attendees. You're very welcome to this Healthy Start webinar, one in a series of webinars that we run. It's great that I can see through our technology here that we have a good healthy attendance, already 33 and counting. My name is Derek McCormack and I am the Senior Manager of Knowledge Exchange working at the PRC based at the Parenting Research Centre. I work closely with Olivia Clayton, whose voice you will have heard on previous webinars that we've run. I'll be doing some more of these in the future, so essentially this is my first time out. Olivia is in the room coaching me with the technology. But welcome everybody, and just a few points of introduction before we get going today. So for those who may be less familiar with Healthy Start, just to quickly touch on that, Healthy Start is a national strategy, and it aims to improve health and well-being outcomes for children whose parents have learning difficulties. And these webinars are one of the ways in which we reach out to those who work with families and link with those who work with families. And it's one of a number of things we do in this space. We also, for example, provide summaries of latest research, and that's something that we do in written format on our website. And those summaries come in a couple of flavors, really. There are readable research products, which are essentially plain English summaries of a piece of research work for something that's accessible and usable in day-to-day work for those who are interested or vested in that work. But also these practice points, which are another research summary type product, but they look at a whole area of research rather than one piece of work. So that's one thing we do alongside these webinars. We also host our online practice network, which essentially a number of you will already be members of the online practice network, but it's simply a online space to connect with, link with, share information with, share ideas with others who are working with families in this space, and those who are either doing it for a while or just getting into that kind of work. And through that online practice network, we share and connect with Healthy Start partners, as we call them, or friends of Healthy Start, and those people can do that with each other. On that network, we also upload the videos of these webinars and a number of different resources that are always there for accessing at any time. So if you're not a member of the network, I encourage you to check it out maybe after the webinar today, and this is where we'll be posting today's webinar as well. We also run face-to-face forums. We run events. We call them knowledge exchange events, where we have Healthy Start partners or collaborators getting together, discussing experience and evidence around supporting families where the parent has a learning difficulty. And we also work to co-develop products and co-develop training and programs with those working with families. So there's a range of things that Healthy Start does, some of them face-to-face, some of them online, some of them written research summary products. But the basic goal of Healthy Start is to work with the system and with services to build capacity in supporting families in this area. So again, welcome to this webinar. A little bit of housekeeping before we carry on and come to our speaker. If you're having any technical difficulties with the running of the webinar or your access to it, you can contact us here. There's a chat box that you should be seeing on the right-hand side, down below on the right-hand side, where you can see the email of Olivia Clayton, who can take emails, queries at any time. You could also, if needs be, contact Olivia on telephone, and that's 0417 487 185. And then as we run through the presentation and into the Q&A bit afterwards, you can ask questions at any time. So using that chat box and also the questions feature on the right-hand side, you can submit questions at any point during the webinar, thoughts, comments, questions, and they will be something we can look through as the presentation is running and then bring into our discussion at the end. The presentation will last approximately 20 minutes, and just after that we'll run into that Q&A session where we'll have a look at any comments or questions that have come up and essentially read those out, discuss them with our presenter. Like I mentioned before, the recording of this webinar will go up onto our online practice network alongside an online discussion. So that will kick off a little bit after we're done, and you'll all get a notification that we have a webinar up, but also the discussion is live. So you can continue the conversation and communicate with our presenter after the event has finished up this morning. And at the end of the webinar, we will have, just as we finish up, a short evaluation survey. So it'll just take 2 or 3 minutes. It'd be great if our attendees could take those 2 or 3 minutes, tell us what you thought of the webinar. It's something that helps us improve them in the future and get a feel for how useful it was for you today. Okay, housekeeping done. So our webinar today, let me just go into an intro for our presenter, Susan Collings, and then a little bit about what we'll be hearing from Susan, and then we'll run a very quick poll. So Susan Collings is completing a doctorate at the moment from the Faculty of Health Sciences at the University of Sydney. It's about children of mothers with intellectual disability. She has a background in community-based case management for people with disabilities and chronic conditions, the frail-aged, and their carers. And she's completed a Master's of Public Health before moving into program evaluations of child and family support services. This work included an evaluation of a specialist program for parents with intellectual disability, which led Susan to pursue her current research, and it's focusing in on children growing up in these families. Her research contributes to literature which has been largely focused on developmental outcomes and child protection concerns by exploring children's social experiences. And that kind of brings us to what we're up to today. So Susan has been great to join us today on presenting a short webinar on the influences of those social worlds of children of mothers with intellectual disabilities. So we're looking at the social world of children in families like these. And so it's an opportunity for us to focus on that experience. The presentation will hone in on some main findings from an Australian study with children, and it'll help us look at some implications for other research and think about future areas of focus relating to this. So we're all set to go. Before we do, let's look to that poll. We thought it would be a good idea to use the technology and our time just before Susan runs us through her presentation to run a quick poll. So we're going to kick that off now, and you'll see it coming up on your screen. The poll is very straightforward, and if we just take a moment to look at it, what we're asking is, in your work supporting families, who do you work with the most? It's quite a broad question, and we've broken it into simply carer, parent or carer, child, or the whole family. We recognize there's a lot of different kinds of workers here and supporters here on the webinar, so you may not fit into one of those simple categories. So you can, if there's another way to express it, just type it into our chat window there on the right-hand side, and it'll be a way for us to simply gauge who we've got in the virtual room, so to put it. So we'll just let that run for a moment more and see what we get. Okay, thank you very much for that, guys. So when we look at a summary of the results popping up again on your screen, thanks to wonderful internet technology, we see that we've got a large proportion, 55%, who indicate it's really the whole family that they work with, and secondly, parent care as a primary focus, and then child, 11% identifying child as the primary focus. Really, that's really interesting, and perhaps Susan can touch on that as perhaps a trend in her experience speaking with those in the field. Excellent, thank you. Okay, so just before we pass to Susan, who I look forward to seeing the slides and hearing what she has to say, quick reminders before we get going. We will have a Q&A session at the end where we'll look at any questions or thoughts that you've had during the 20 minutes or so. And again, we will run that short evaluation survey when we're all done, a quick 2-minute survey to gather your feedback on how things have gone. So we'll now pass to Susan, who can get going with the presentation. Susan, can you hear me?
I can, Derek.
Welcome, and thank you so much for joining us today.
Thank you for the invitation, and thank you for that warm introduction. This is my first time on webinar, everybody, so I'm just going to pretend that I'm going to use my imagination and pretend that you're actually in the room with me. I'm confidently assured that you are. So, look, yes, Derek has given an introduction to what I'll be sharing with you today. This is a study that I undertook as part of my PhD at the University of Sydney, and I wanted to first of all acknowledge the guidance of my supervisors, Professor Gwyneth Llewellyn, who many of you will know the work of in this field, and also Dr. Rebecca Grace from the University of New South Wales. So today, as I guess my aim would be to talk to you about what I found and how this might fit with your own professional experiences working with families. So the study set out to really address two key questions. One is about understanding what influences there are in the social worlds of children, of mothers with intellectual ability in middle childhood. And I'll talk a bit more about middle childhood, but basically in Australia, just think about that being the years in which children are at primary school, so around about 6 to 12. And what influence the home they share with their mother has on their social experiences elsewhere. And I guess that comes out of literature I'll talk to you about in a minute about what the social context for their mothers might be, or what we know about that social context, and how this research was sort of designed to learn more about how that context might make a difference to children's social worlds. So again, I'm putting this slide up now for us to think, for our discussion in the Q&A session at the end. Again, really just sort of getting you to think about how what I found, or what we found at Sydney University, gels with your own professional experience, and any ideas on how your own service or others that you're aware of could focus more on the social needs of children, and what barriers they might face in doing that. Also, I'll just sort of mention what might be a special group of children within this group of children, and those with special needs, perhaps due to disability or behavioural difficulties, and your experience with that. Okay, so we'll come back to those at the end. Now, I'm starting by just giving you a little bit of an overview of the literature. I don't want to kind of go into that too much, but I think it's important to set the scene for this study. So what do we know about these children in middle childhood? Well, what we know comes from a very small group of studies, most of which are actually studies with adults. So adults talking about their experiences of childhood. And while there are many, there are many things that come out of these couple of studies, one common thread is about social difficulties, things such as bullying and ostracism and stigma. In the main, 80% of research in this area has focused on risks. So the risk of developmental delay or the risk of abuse and neglect for children. We really don't know very much about children's experiences, and we certainly don't know very much about children's perspectives, so their voices are quite absent from the literature to date. And you can see why that might be a problem when you think about 80% of the literature focusing on risks associated with their development and where they live and with whom. So in terms of what we know about the social context of their mother, as I mentioned, there actually is a substantial body of research that has looked at the social worlds, I guess if you like, of their mothers, the social support needs, social participation. And what these, I'm just going to summarise the main findings from my review of this. One is that mothers who have support don't always experience that support as being confidence promoting. They may actually experience it as the reverse. In the main, support comes from family and professionals, and I apologise for that background noise. There's some work being done. What we do know is that from a number of studies, there are mothers have few friends and neighbours in their social networks, and a group of mothers with intellectual disabilities are more at risk of socialisation because of that. What we found is that there are three kinds of social networks, and they depend on who a mother lives with. One is where a mother living with a partner, and in that case the social network is wider just by virtue of having two extended families. In the second, it's mothers living with their own parents and raising children with grandparents, if you like. Those networks are more restricted and include formal services, but the most restricted social network would be mothers living alone without the support of family, and again, typically without the support of friends. These mothers are quite light on services for support. I suspect many of you will work with these mothers. Quite receptive to formal services, and in fact sometimes consider the services as friends in the absence of others. What the review also showed or revealed was that most studies have been conducted with mothers from socioeconomically disadvantaged backgrounds. In general, what do we know about children in middle childhood? It's important, obviously, to put these children in the context of what we know about middle childhood social worlds in general. So clearly, and one of the key features of middle childhood is that children start at school, and that is an indicator of the expansion of their social world beyond the home. They come to spend much more time with peers and with other adults who aren't their parents, such as their teachers or sports coaches. They also come to spend more time in their neighbourhoods, playing with friends, going to the homes of friends, and with this comes a greater desire or a thirst for autonomy and freedom of movement for children, typically over the course of the primary school years. Mothers in the home still remain an important influence for children throughout middle childhood, and this is, I suppose, in the context of their social interactions, this is partly because of their role in monitoring whom their children see, both at the home and the friends they see, so in the neighbourhood. Also, mothers have a role in their children's social networks at this stage by virtue of the access they provide to their own social networks. So the people that come to the home invited by the mother, so family and friends, are part of the children's social network by virtue of their mothers. So influences for mothers might be the things that have come out of the research, whether they consider the neighbourhood safe, so that might influence their decisions about whom their children see, and whether they have freedom to move around the neighbourhood. And again, just drawing you back to what we know about from studies about this group of mothers, is that the studies with mothers from socioeconomically disadvantaged backgrounds, and that may be an important feature of their influence. And in terms of the social networks, well, clearly, as I've also mentioned, mothers have smaller social networks, and largely these are not comprised of friends, but of family and formal services. So this is also an influence for this group of children, potentially. So the study is addressing the research gaps that you'll see on the screen. We know that social isolation and the absence of support that mothers consider appropriate can make their parenting more difficult and can actually lead to parenting stress, and that can have an impact on their children. We know that from a small number of studies, not necessarily conducted with children in middle childhood, most likely, most are conducted with younger children. But we don't know yet whether a mother's social context directly influences their children's social context in middle childhood at this time when their social worlds are expanding. What we know about children of mothers with intellectual disabilities is really based on infants and young children in the main, or on adult recollections of school life. Only one study, and it's a Danish study that isn't published in full in Australia, it takes a child's perspective of their lives. Now, just very quickly, I won't dwell on this, but I wanted you to understand a bit about the theoretical context for the study, or theoretical background. I used two studies to think about these children, two theories to think about these children. The first is called bioecological theory, and it comes from a developmental psychologist called Yuri Bronfenbrenner. Really, what this contributed to my study was that it said children cannot really be separated from their environment. They're part of it, and they're interconnected with many different social contexts. And it's their interactions in their daily lives that shape their lives. And you can't understand what influences a child's life by looking merely at one social context. You have to look at the child's environment as a whole. The second theory is called the sociology of childhood, and really what that contributes is just an appreciation that children are actually experts about their lives. They can give us a perspective that is different from adults, but that is worthwhile hearing in research, especially research that's about their lives. And they're agents. They have agency. So they are not the passive recipients of others. They, in fact, are engaged in their social environments, which ties back to bioecological theory. So we're seeing children as active participants. I used a narrative approach to analyse data. This was really useful. I think it's recognised as being useful in research, qualitative research, because it helps us to understand how an individual sees their life. We tell stories to each other to explain and to make sense of our lives and the things that happen to us. So they actually come to reflect our view of the world that we inhabit. This is particularly useful with children because storytelling is a familiar activity for them. They're already immersed in the world of storytelling, and it's a way of hearing their perspective, getting them to tell us about their lives. It enables us to understand what sort of influences shape their lives. So that's just a sort of a background to how I approached the study. More specifically, I recruited through mainstream, what I'm calling family support or specialist parenting services, including Healthy Start, which was very instrumental in recruitment for this study, and also through a professional contact. And that professional contact enabled me to reach some families who aren't engaged with formal services and would otherwise, the children would not have had an opportunity to participate. So in the end, I was able to recruit 7 children to the study. They were aged between 7 and 11 years. Incidentally, or coincidentally, there were 2 sets of identical twins, 2 boys and 2 girls, obviously. And overall, there were 4 boys and 3 girls in the study. All of them lived with a mother with intellectual disability, but there were diverse homes. So some lived with a single mother, others in a 2-parent family, and some lived with mothers who were more isolated than others. When I describe the methods I used, I describe them as child-centred. I used sort of evidence-based methods that have been used in research and have been demonstrated to be good ways to engage children with research. So I did use semi-structured interviews, so there was an interview guide with some topics for discussion rather than a set of fixed questions. They were discussion topics about their experiences at home and at school and in their neighbourhood, and also particularly with peers across that. But I also did use photography and drawing. I used a method called photo voice, in which I asked children to take photos of important places and people in their lives. And in the interviews, children were invited to draw their social relationships in a sort of a diagram. That's a brief overview. Really just kicking right over to what I found when I analysed their interview. I used, as I said, a narrative approach, so I created a narrative of their which was a story, if you like. The children participated in at least 2 interviews over time. So that story might have been about their life over a whole school year, for instance. That was the case in a couple of instances. You'll see up on the screen what I consider to be the main findings. And you'll see that they draw back to the home that children lived in. So I found that there were some key features or influences in their homes, one of which was having what I'm calling a predictable and stable set of routines and rules. So children talked about their everyday lives, and they talked about the things they did and when they did them, and that enabled me to clearly distinguish where the children actually understood, had a clear sense of what would happen today and tomorrow and next week and the days in which they did things, and children who didn't have that level of appreciation of their daily routines. The second feature of their home that I found was a defining characteristic was whether they had support from another significant adult other than their mother. And I'll get onto that in a minute. So the children who saw their homes as predictable and who had access to this second adult for support approached social interactions away from home with more confidence and more optimism that they would have positive encounters in the world beyond the home. So you can see that sort of drawing back to the theories I talked about, to Bronfenbrenner, that interlinking between the home influences there and in other places, the impact of that on other places. These children saw their friendships as stable, and that's not to say they didn't have arguments. They didn't talk about, they did. All the children were able to talk about both positive and negative experiences with their friends, but they saw their networks with friends as stable. So that didn't mean that friendships didn't change, it just meant that they had a sense of having stability in their friendships. Conversely, children whose home lives had fewer routines that they could name and who didn't have a supportive adult, these children were more pessimistic about the likelihood that they'd encounter a positive set of interactions elsewhere. And those children did face some bullying and also had behaviour problems in some of their interactions with peers and in school settings. So this social support I'm talking about from a significant adult other than the mother influenced social context for children by helping to create a predictable home base for children. And I think important for us to talk about who that significant adult was. As I've said, these were diverse families, and the types of home the children lived in were different. So they didn't always have a father. One child, in fact, only had a father as that significant adult. In other cases, it could be another family member, but it could also be a formal service. The key was that the support they received from that person was ongoing, predictable and regular. There was a trust relationship, and that support was focused on that child's needs. So it was about a relationship between that person or people and the child, understanding what that child needed to support their social interactions. And that might have been helping them to access after-school activities, or fostering a talent they had, providing support for them to develop talents and interests. I also these individual narratives also permitted me to really dig below what the children were saying about, for instance, about everyday routines, and really look at some common threads that were woven through the stories of all the children. And I've got 4 themes there: protection, agency, validation and trouble. It's important to say that each of these was expressed quite differently in the lives of individual children depending on their particular context. So some children, for some of the children, trouble might have been encountering, sort of domestic violence, and at the other extreme, it might have been having an argument with your best friend. So, these could be quite everyday experiences, or they could be quite sort of serious conflicts. Protection was about not only feeling safe and having adults who were protective, but importantly, it was about knowing that mum was okay. Children who were protective of their mothers, and this was sort of a thread running through their stories, was a concern for their mother's either physical safety or her well-being, or a protectiveness that she not be criticised. It's worth pointing out at this point that none of the children were asked or explicitly talked about their mother's intellectual disability. That was a deliberate choice not to preempt that this was something that they were going to experience as an influence. It wasn't a study designed to look at what it was like having for them to describe that experience, but this did come out nonetheless. I thought it was worth talking about what these results might mean for you in your service. I think it's really significant finding that these services that you work with can actually be a significant adult in the life of the child. And that's particularly important, I think, for children who don't have another significant adult apart from their mother. Again, I've talked about what that involves, what that needs to involve. But I think that is a key finding, that that formal services are not just an important source of sort of indirect support for children by the support they offer to mothers, but can actually directly play a role in children's social worlds. In middle childhood, we found that the children valued feeling safety, having a say about the support they need and receive, and being seen as an individual. I think these three things are quite key. They're things that have, or aspects of middle childhood that have been reported in other literature, not with children of mothers with intellectual disability, but again, in the nuanced findings of this study, I think they're particularly pertinent. So being seen as an individual rather than just, in fact, perhaps in terms of services, being seen as the child of a mother, who is the recipient of the service. And other studies have found that children who receive formal services want to have a say and want to be seen as a person, have a say in what services and support they receive. And I think this did emerge in this study. Particular for this group of children was, again, that, as I mentioned, that sense of protectiveness towards their mothers. Oh, I had another slide. It seems to have gone missing. I did want to talk about the situations, I guess a case study of one child who really just as an exemplar of how formal services supported him. So this is a child who lived with a mother with intellectual disability who had no family support, and her friendships were quite limited to the supported employment environment. So not many visitors to the home. The visitors to the home were primarily a team of formal services. They'd worked with his mother for many years, providing sort of independent living skills, training, and they came to the home twice a day. But I think the important point about that service and that child is that the services weren't just directed to the mother. The child had a relationship, for instance, with one carer where that person took him fishing every week. This is a really significant adult. It was the person he identified as being the other person apart from his mother whom he trusted most in the world. And this was a formal service. Other workers would take him to visit their home and to walk their dog. So it was very normalised, not always conducted in his home. It was his life was they were part of his life in the broader, in his broader social world. But they did take him to school and they took him to sport, and that child had a large and stable friendship network and a very healthy sort of and positive attitude towards himself in relation to his social encounters, and I think is a good sort of demonstration of what services, what role services play. How are we going there, Derek? Hello? Hello?
Hello, Susan. We are good. You can take another couple of minutes as needed.
Okay. Sorry, I just I suddenly thought, God, have I lost everybody? It is,
Not at all. Please, it's fine.
Look, I'll just draw towards the close of the presentation by I guess signalling what I think is the main finding from this study, and that is when you ask children about their perspective of their social world, you find that they are not necessarily restricted. This group of children did not necessarily have the restrictions on their social world that their mothers had, and some of their mothers did have quite socially restricted contexts that were similar to those reported in earlier studies. So it wasn't that this was a particularly unique group of children of mothers with intellectual disabilities who didn't look like those that had been reported in earlier studies, but just that the children didn't perceive their worlds as restricted. And indeed, children showed great sort of ingenuity in fostering their own social opportunities when they had mothers with quite restricted and small social networks. Children could, for instance, one child who was very eager to do after-school activities and her mother was not so eager, she would bring home pamphlets from school about activities that were free, and then she would, when her mother would agree to take her to these activities, she would then give the pamphlets around to her school friends and encourage them to come along, so that she was creating a sort of a conduit between her social world and finding opportunities for those friendships to develop away from school, which was a really big thing for her because her mother didn't like, she was quite private and didn't like inviting people to her home. So this child found another way, and I think with great ingenuity. I think that the study does point to some future research that's needed. As I said, I particularly wanted to look at children growing up with a mother with intellectual disability, but we do know that these children are at significantly elevated risk of being removed from their mothers, and we don't know anything about their social experiences when they are removed. So that's absolutely number one, is understanding their life experiences from their own perspective when they've been removed from the care of mothers with intellectual disability. I also think what would be an important study is to understand social experiences for children who have behaviour problems or have interactions with their peers are difficult. This study found there were some children who had problems in that area, and it would be really worth exploring that more deeply. It would just be on the scope of this study to go into depth about what those experiences were like and what possibly could be done to support those children in their experiences. The other thing the study didn't do, and it deliberately didn't do because it was taking a child's perspective, was to I suppose give us a 360, so to get a sense of an individual child's world from their own perspective, but also from those other significant adults, perhaps family members and parents and mothers, but also possibly teachers, just trying to understand different perspectives on the lives of children. So, it's early days. We clearly need to understand a lot more, but I think this study does contribute by making it clear that having a mother with an intellectual disability isn't itself a risk, and in some cases that has been a presumption made in the past. to great detriment for these children. Yeah, so thank you. And I think, oh, there's that. There we go. That was put in the wrong spot, people. Yes, this is the child I talked to you about. I'll just leave that on the screen for a minute.
Thank you so much, Susan.
Very welcome.
Can you hear me now? Okay,
yes.
and thank you very, very much. That was a wonderful presentation, and of course, not the most naturalistic way in the world to deliver some messages and content, especially first time over webinar. So thank you so much for that.
You're welcome.
We do have a couple of questions that have come through, which is great, and we'll get to those just now. From my own perspective, I thought really, really insightful, really interesting to hear about that work which focuses on essentially the child voice, which I think a lot of people feel is a great direction for the future, where we are getting the voice of the children in these contexts somehow reflected in our knowledge and practice.
Yeah.
Yeah, so thanks so much for that. And particularly I thought was really interesting was the notion around that finding where children feeling or expressing protectiveness over their parent, and how that might relate to advocacy from the part of the child within the family dynamic.
Yes, I think it is interesting, and I don't know if I mentioned it, but it isn't something I've encountered in my reading of the literature about middle childhood. So that's not to say it isn't there, but I haven't encountered it. I think it is something peculiar, if you like, to this group of children, and may say something about their role as somewhat of advocates for their.
Yeah. Great, and just in terms of questions from our attendees, just so you can connect with those attendees, having spoken to your microphone till now, we have a question from Alison, which was just, can you specify the intellectual disabilities that were present in these families, in the mothers? Did the study include, for example, involve mothers with mental health concerns as well?
So, Alison, first of all, I've chosen to use the term intellectual disability rather than learning difficulty, but it is used in a similar way. I've used the social systems definition. I didn't conduct any, the mothers were referred by formal services, as I said, or professionals with knowledge in the area, so I didn't actually conduct any sort of confirmation of that. It was a social systems definition. And because I didn't interview the mothers, I didn't ascertain any other disabilities that might have been present. However, incidentally, I did learn about, mental illness in the form of depression in the case of one mother, but no, I guess, in fact, in terms of thinking about future research and that other perspective, that might be worth delving deeper into, because this was really just to hear children's voices. Interestingly, though, in the case of the mother who divulged to me in conversation that she had been suffering depression, that did play out as an influence in her daughter's social worlds, because that mother was quite housebound, if you like, for a while because of her depression, and when she sought treatment, the social opportunities for her daughter did increase, because she was able to then support her daughter to join groups and so on. So it actually, incidentally, I did learn about that, and it was something that was important in that child's social context.
Great, yes. Another couple of questions here, so we may go just a minute or two over, if that's okay with people. And we'll also continue the discussion online afterwards, later in the day and tomorrow. And another question that came through from Erin was, did you find any difference in answers or tone between male and female children? So any comments there?
I haven't. I guess because it was no. I didn't really analyse gender as a particular kind of variable, if you like. The children were. Yes, no, I wouldn't be able to say there were differences based on gender. However, the one difference that was based on gender was that it was only boys who experienced bullying and sort of what is commonly called, sort of peer rejection. So the boys were the only children who experienced those sort of difficulties, but there were boys that didn't. So I guess I qualify that. And again, I do also, draw attention to the fact that it's a study of 7 children. So really, with that size, I wasn't able to look at gender particularly, but I hope that helps.
It points out that interesting area for the future around experience between peers, between children. Another question that we have through is from Nicole, and it's asking, are there any study on younger children and the effects of having a parent with ID, especially the under 5s? So essentially, younger children.
So there's as I sort of spoke to, there's a number of studies that have been conducted with younger children, quite several that would be on the Healthy Start. You've got your sort of reference library there. They're largely about sort of language development. So there's quite a number that have been done in the first 2 to 3 years, and that look at sort of cognitive development. There are other studies where sort of the age is broader that have looked at, I think mostly when they're with younger children, they're not looking at their social experiences, they're generally looking at developmental. I'm casting my mind back, but I can't think of anything particularly about social sort of preschool life. Is that what Erin was referring to?
Yeah, the under 5s and the effects, or this kind of study, a study around possible effects on the child's experience, especially in those early years. It is a good one to pick up on our online discussion, I reckon. And in there, we can have some sharing of links. Maybe just time for one more, and we can wind up our webinar. And this one is just coming from Anne, and it's a question which is, what was the support for the child in the case study paid or voluntary? So thinking about that case study, was that support paid or voluntary?
They were all paid workers.
Oh, okay, great.
And I recognise that is also a key point. Is there was a high volume of support provided in that particular family. And I, from my background in community care and disability services, appreciate that is not common. So that's, I guess, something that's food for thought of how whether there are possible ways that volunteer services could be incorporated, modified.
Great, and we do have another couple of questions come through there, and unfortunately, I think we do need to wind up. So for those guys who have a further question or would like to take that further with Susan, we can have that continued on the online discussion. So I'll just wind things up in just a moment, but first, thank you so much again, Susan, for your time and for your presentation today.
You're really welcome, and I hope it was food for thought for the audience.
Absolutely, I think it would be for anyone considering the experience of children in these families. So, and certainly some great ideas for future areas of work. So, to our attendees, thank you all for attending. We will be running an online discussion alongside the published webinar itself, uploaded onto our online practice network. It's very easy to become a member if you're not yet, and then you can log in and see this webinar and join the discussion. And lastly, we will be running that short evaluation survey, just a minute or two of your time when we finish up here which is now pretty much. So again, thank you so much, Susan. Thank you everybody for attending, and we'll catch you all soon as you'll hear about the next